involved in that dialogue, which is an adult model for mobile crisis and response, where the MRSS model is for children and adolescents, because children and adolescents and young adults need a different mobile response system, crisis response system than adults do. And also, you probably know that 988 will go live in July. That people can call 988 to get assistance, and that will go live in July. And the response will be the response that, someone is unfortunately suicidal, or they are in some kind of crisis, they can call 988 and be linked to a hotline. And that expansion is happening in July. Janet, could you also give an example of the work you do with the school system? A number of things that are challenging for parents who have children with behavioral health systems is, do they need special education? And what is the level of care they need within the school? So, Janet, could you say a few words about that?
As Celia said, I will go in. I do a lot of kids with school refusal, suicidal ideation, some severe behavioral issues in school, throwing desks, biting, kicking, leaving the school campus. And when I go in, I work, as I said before when I was explaining, I go in for a certain reason. I find a host of all other things that these parents are dealing with.
Oh, Janet, we can't hear you. Can you check your mic? You can mute and then unmute and see if that works. Now, unmute.
Can you hear me now?
Yeah, great. That's beautiful.
Okay. How much did you not hear? The whole thing?
No, just the last sentence or so.
Okay. Sorry about that. Anyway, I go in to try to work with the parents to get an individual education program that helps them get into special education and get the services they need. For instance, Montgomery County has a lot of self-contained classrooms for kids with emotional issues. And the county also has what they call special education support services. And they have classrooms in different schools. And if a child is behaviorally having problems or challenges in school, that we may suggest to move them to one of these specialized classrooms. We deal with a lot of kids who are, I don't want to say acting up, or negative behavior, but that's what it is. I'm working with a kid right now who has significant mental health issues. And at first I was brought in to do an individualized education program to help him get the support services and classroom he needs. Come to find out that he has suicidal ideation. He threatened a science teacher by saying he's going to smash her room to smithereens. And he's a ticking time bomb. And he's escalating. His behavior is escalating. And so I went in for one thing for school to get him the proper care he needed in the school, and ended up with something else. But what I'm seeing now after virtual learning is a lot of kids don't want to go back to school. They're depressed, they're overwhelmed. And so I'm working with kids like that to get them back into school, back into the programs they need, and get the credit recovery programs that they need.
Thank you, Janet. Does anybody have any questions about that? I did send Betty the referral form. Anybody can refer to us as long if they are a parent or primary caregiver who has a child, youth, or young adult with behavioral health needs, and they are in Montgomery County, they can refer. You could refer as a nurse to us. They could self-refer. Nobody pays. Montgomery County pays us to deliver these services. We are funded through Montgomery County Behavioral Health and Crisis Services to deliver these services to families. So I did send the referral form to you, and I also send the consent to release. So let's say you are the faith nurse working with the family wants you to be continually involved. They can fill out the consent to release information and give us permission to talk to you. And that way everybody can be on the same page. So I send both the referral form and the consent to release. So I hope that gives like a picture of kind of the work that is so complex, because we know, because of COVID and the issue of institutionalized racism, the issue of the siege on the Capitol, there were a lot of collective, historic, and individual trauma that families have faced over the past 2 years. And as a result, we see increased depression, increased anxiety, suicidal ideation, suicide attempts, overdoses, mostly due to fentanyl. And I was told by the prevention specialist with the county, with HHS, that a lot of substances are being laced with fentanyl, even marijuana being laced with fentanyl. And as a result, there are overdoses. As faith nurses with Holy Cross, you probably know that there are hospital overstays, a huge problem in the state with hospital overstays, meaning either young people are stuck in the emergency room waiting for an opening, or they're they're at the hospital but waiting for the next step in terms of treatment. And the Behavioral Health Administration at the state level, on the Department of Health, Maryland Health, is trying to address this issue of hospital overstays. It's a huge problem for kids to be stuck at hospitals or stuck in the emergency room and not being able to get the care that they need from the behavioral health standpoint. So let's move to the next slide. And let me see here. I'm trying to get to the next slide. Okay, how am I getting here? Okay, I skipped up here. So let's see here. Nope. I'm trying to get to the next one. Sorry about that. Okay, job function. So we had all our staff now are called our parent peer specialists. And they used to be called family support partners and family navigators. And Janet explained in a beautiful way the way that we work with families. We work with them where they are. We try to build trust and rapport because we have common lived experience, and then we move them forward in terms of empowerment. This is not about knocking on a door and getting a service and then going to the next door. Because when providers come in and out of the family's lives, then what do families have is a toolbox. Families need to be empowered. They need to progress on their journey towards self-advocacy and self-efficacy through the acquisition of skills, knowledge, and a network of support. The county, as I mentioned, sustained Wraparound. And this is JESA, the Jewish Social Service Agency, is the provider group that is doing Wraparound. It's a coordinated child and family team that supports a family and is strength-based and helps a family get what they need, especially when a child is multiply served by different agencies. We provide the family support to families in Wraparound. And we provide support to families who are not in Wraparound. So we, as Janet explained, this is about helping the family become empowered, gain skills, become the best advocate for their own child, and be able to be self-efficacious. Of course, there are barriers that we can't have. We don't have a magic wand. Affordable housing. You know, I mean, really, you know, we struggle a lot to help families. Families due to COVID many families had food and financial insecurities, and we tried our best to help, you know, with the landlord issues as well. But you know, there's barriers that families who are undocumented, who can't get comprehensive care. And so we do whatever we can, thinking outside the box, to help families who are facing barriers and gaps to get what they need. And it's complicated. Like I said, the affordable housing issue, or being undocumented and you can't get comprehensive insurance. You can get care for kids, but care for kids is not comprehensive. Or you go through one of the safety net clinics to help. Working with Catholic Charities, working with other groups to be able to get the needs met.
Celia,
and yes,
may I say something?
Absolutely.
I just want to interject something that, excuse me. I try as a peer support specialist, formerly called a navigator. I I try to connect families to psychiatrists, therapists, and it's very difficult to do. They're not even having waiting lists anymore because there's too many people on the waiting list. And they end up in the ER because there's no one who has done prevention with them. There's no one working with them long term. And they have an intense crisis. And that's when they end up in the ER. But the state of mental health, children's mental health in this country is a very severe situation. But what's scaring me is there are not enough practitioners. So these kids, as I said, end up in the ER where they shouldn't have ended up there. If we could have an infrastructure where there's enough social workers, psychiatrists, therapists, psychologists. I cannot get my kids in anywhere. And a lot of our families are economically disadvantaged, and I can't find providers that take Medicaid. So it's a real conundrum. It's a very difficult situation. And it's very hard for me because I want to connect them to someone to do prevention rather than reaction.
That's a good point. And as you know, in Montgomery County, in the Maryland and in the nation, there's a workforce crisis. People are not able to, there's a difficulty recruiting social workers, recruiting psychiatrists, getting therapists, getting bilingual therapists. And there was a law that was passed, emergency law about a state law that just passed the Maryland Assembly this last session to reduce requirements like licensing requirements and educational requirements to try to build the workforce. Prior to the pandemic, there was a problem with psychiatrists wanting to go in the public mental health system. The rates that are offered are lower than other places. The cost of living in Montgomery County is very high compared to other jurisdictions. Self-sufficiency standard is high. And so you have psychiatrists and social workers, but particularly psychiatrists, who do not want to work in the public system. And there are psychiatrists who do not even want to deal with private insurance. If you come to them, it's up to you to deal with your insurance. And we do have parity legislation on a federal level, state level, parity legislation, but it's really, getting other laws passed to ensure parity, that you can get parity for behavioral health services like you do for physical health. So it's been a real challenge. And so as a result of that, we have wait lists. And what happens when you have wait lists, like Janet said, the child decomposes, winds up in the emergency room, and you have to meet the benchmark of acute being suicidal or having homicidal thoughts to get in. But, that isn't the initial issue that caused the child to go to the emergency room. So they go home. And then they go home. It's a crisis again. They go back to the emergency room. It's this revolving door. And it's not because of Montgomery County. It's because, where is the workforce to support if we do not have, and psychiatric nurse practitioners are a wonderful addition to the array. Psychiatric nurse practitioners, there's a great need for psychiatric nurse practitioners, and they are used in Montgomery County. So, how do we build capacity for people to deliver mental health services? And that includes substance abuse, because the state closed a lot of the substance use treatment facilities for adolescents also closed. And so where do young people go to get treatment for their substances? We do have a recovery school at Shepherd Pratt. And we have, the landing, and we have other programs to help, but we need more, especially since this is a huge problem. There have been suicides in Montgomery County Public Schools. There have been overdoses. And we really need to say, we really need to come together as an integrated community across fields, nurses and doctors and social workers and peer specialists and policymakers and agency heads to really brainstorm how we're going to address these issues. Now, the Collaboration Council is a local management board in Montgomery County. And every jurisdiction in Montgomery County has a local management board that is charged with building a better system of care for young people. We provide the family advocate who sits on the local care team. The local care team includes disability services, child welfare, juvenile justice, behavioral health, the school system, and it's chaired by the Collaboration Council Local Management Board. And children are presented before the local management board to try to get help. And the agencies try to brainstorm where, what they can do to ensure that they can get the child the level of care that they need. So if you want that referral form, I can send it to you. It's a referral form from the Collaboration Council where you would like a family to be presented before the local care team because the complex needs. I'll give you an example. We got a referral from the Collaboration Council to work with a family that's undocumented where the older sister is involved in sex trafficking and using substances, and she's encouraging her younger sibling to do the same thing. She has a very wide network for some reason, and child welfare was involved at one point, and then juvenile justice was involved because she took a car illegally, and the special victims unit was involved, and we kept on bringing this case back to the Collaboration Council because this young person really, she's been in residential treatment before, and is now not going to school at all. There's a younger child in the house. Dad, it works, and while dad is working, there's prostitution going on. And, we are bringing this and we reported this to Child Protective Services. We got the detective to come and talk to the local care team because it's going to take more than one agency to help this family. The needs of this family are so great. And we have a lot of trafficking going on in Maryland and in the nation, sex trafficking. And so, we are brainstorming with they referred to us initially to refer the family to the SAFE Center. The SAFE Center at the University of Maryland has no openings, but the detective from the Special Victims Unit had referred the young person to that program, but she didn't want to go. This is an example of the complex need. Voluntary placement agreements. When Ehrlich was governor, families were relinquishing custody in order to get mental health services for their kids. So Governor Ehrlich issued an executive order for voluntary placement agreements, and it eventually became law through legislative process. And a family can ask child welfare for assistance in placing the child in a higher level of care. They do not have kids who have non-public on their IEP and need residential treatment for clinical reasons don't have to go through this process. And we advocates, actually, this past legislative session, I work with the Maryland Children's Behavioral Health Coalition. We have tried to change this, but kids who are not in special ed or who do have special ed but don't have non-public on their IEP have to go for this voluntary placement agreement, which is very difficult to get a certificate of need in order to get residential treatment. So the local care team also reviews these cases. So I just wanted you to be aware of that because that's another option for faith nurses, if they want to make a referral to the local care team because the complexity of the family is so great. And we can help with that. We can help you with the referral form. As I said, we have a family advocate who attends weekly the sessions. They have about 3 to 4 youth that are presented at any given time. And then we ask the family, the caregiver, to also come and present to the family and say what their needs are. Are there any questions about the local care team?
I have one question, and that is, when you're referring to children, this is all if you're 18 and younger, or?
No, for us, it's not. For us, it's not 18 or under. Now, there are different mandates by youth serving agencies. So you'd have to know the mandate of let's say the age for wraparound, because the local care team can refer people to interagency family preservation, and each child serving agency has a eligibility criteria, and the YMCA runs that program. They can refer to wraparound, which it had been 18 and or younger, and there was a movement to push that higher through a grant that we had with the county. Jess and I were working on with the Collaboration Council was to push that age up. Because tradition age youth can be deemed all in up to 26. One group, Dr. Rusty Clark, who does a transition to independence program for young people, actually pushes up to 29. But each youth serving agency has its own mandate. You program based on how its funding deems that. If someone has a youth that's 19, they can come to us. We've worked with youth parents who had kids with autism. We've worked with behavioral health needs, substance use, and we meet the, so we don't have the strict criterion that says you have to be 18 or younger. For residential treatment, yes. For residential treatment, there are very strict rules. So if someone's close to 18, they probably will not get in a residential treatment facility. Very difficult to get in a residential treatment facility, like Riker Residential, for example. So thank you for asking that question, because that age piece is, I consider that a barrier in terms of system of care evolution, because we have these concrete barriers based on rules and regulations that preclude certain kids from getting certain levels of care. So thank you so much for bringing that up.
Celia, may I interject something?
Sure.
I just thought of something. Something that I love about our organization is I'll give you one quick example. We had, I guess, a 14-year-old who had suicidal ideation. They went to Shady Grove, to the emergency room, and had an emergency room psychiatric evaluation. Then they decided that the child needed in-hospitalization, inpatient, and got a bed at Venice Behavioral Health. And he stayed 1 week, and they tried to give him tools to handle his home situation. And one of the things I love is that the child can get tools, skills, anger management skills, frustration management skills, how to deal with their parents, but then you put them back into the same environment. And what we do is we work with that family to make the environment healthy. So when the child leaves inpatient, they're coming home to a family that's working very hard to take away the dysfunction. And so we're the piece of that makes it so the environment is better for the child. It's just, I've worked with so many children where we get them where we need them to be, and then they go home and they regress.
And I think that the parenting skills, this is not in any way blaming families at all. It's just because the parenting skills, I know that, when I had struggles with my kids, and I'd go to family gatherings and say, well, if you just took your child, if I had your child would not have problems. And they would blame, this is not blaming families at all. It's saying that what you need as a parent, your parenting skills that you need to address your child with special needs need to be different. That the traditional strategies that we use to help somebody that doesn't have a behavioral health, does not necessarily work with those who have depression, anxiety, bipolar, schizophrenia. And so we need to be able to tailor and help the parent with coping skills. And we do that in our support groups as well. So this is no means saying that the family is dysfunctional, and do we say that at all. It's that the situation requires different things. If you have a child with diabetes, right, then the parent has to do certain things around eating and snacking and sleeping, and the parenting skills to support the child with diabetes has to be in a certain way. Similarly, if you're raising a child who has schizophrenia or mood dysregulation, then you have to be able to have parenting skills that can meet those needs. So in no ways is blaming a family. The families are doing the best that they can, given the circumstances and given the terrible 2 years of the pandemic and so much trauma. Our construct, again, is that a family's journey towards self-advocacy and self-efficacy is through acquisition of skills, knowledge, and a network of support. And that's our mantra. That is our motto, that if we can give parents skills, and thank you, Janet, this is perfect timing for the slide, gain knowledge, but not only gain knowledge, they need to be able to use the knowledge that they gain, and link to a network of support and resources. We worked for a good number of years with Dr. Bruno Anthony, who was the head of the research at the Child Center at Georgetown University, and we developed a tool called the Family Journey Assessment. And it's the first tool that came out of the experience of families with behavioral health challenges who are receiving peer support to help know what a family needs. And we developed this tool with Dr. Bruno Anthony. And Dr. Bruno Anthony's not at Georgetown, he's now at the University of Colorado. And we have a number of sites around the nation that are now using the tool. Georgetown, the University of Maryland, Georgetown and the Federation, our organization owns the tool. And we have a number of sites around the nation that are using this tool to say, what is it that a family needs when they come from peer support? How can we measure progress from the perspective of peer support, right? It's different than clinical, right? Child well-being measures. Although the improvement that focusing on the parent and what the parent needs, we know will improve child well-being measures. We know that, but we have to also honor that the family's journey is as important. Right? It's not just we don't want Johnny not to get arrested again. We want Johnny to get treatment. We want him not to get expelled or suspended from school, but we want to help mom and dad. If it's a grandparent, we have a lot of grandparents raising kids. We even have great grandparents raising kids. That we want to support them and their ability to be self-efficacious and be able to advocate well. Let me get to the next slide here. So because of the family support model, we try to build legacy families. Everybody that works for my organization and the board of directors, we are all legacy family members. We are families with lived experience who have decided to work in the field. So the model here is that the staff work with parents and other primary caregivers to identify targets and benchmarks focused on individualized family peer support. The staff then provide that support, help to parents and other caregivers to resolve their own challenges and address their unique needs while moving them into a legacy stage where they assist other families with similar issues. Parents and other primary caregivers have the opportunity to become leaders and genuine partners at every level and phase to influence local and state policymaking, and parents and other primary caregivers become advocates for their own children and champions for other children and youth. So we have, as I said, everybody with us, or including me, we're legacy, but we also, for example, in our support group, Janet could talk about, in a support group, we helped a family become a facilitator of the support group. That's an example that we're supporting. We have families presenting testimony before the state legislature, before the Senate or the House, that we help families and youth emerge as leaders and who choose to. Not every family who gets support is going to want to be a legacy family, but we give the opportunity to them. Lastly, Lucia, as you know, the National Federation of Families is working with the University of Maryland to help with the vaccine education. It's ending this month. And they asked us to work with them, as well as other chapters of the Federation of Families, Delaware and West Virginia, as well as mini grants that went out to other chapters of the state and local chapters of the Federation of Families. And we have been working, we developed a Vax for Life campaign. We do education and outreach. We're so pleased to be able to partner with Lucia and Holy Cross on this. We give, when families get vaccinated, we do have pharmacists and providers that will do vaccines for us and boosters at events. And we've worked very closely with the Church of Jesus Christ of Latter-day Saints, with, of course, with Holy Cross, with Olive Branch Church and others, to be able to encourage the vaccines and the boosters, to address misinformation and erroneous beliefs. We've also partnered with the Gaskin and Porter Health Improvement Center. So when people, either our people give them a vaccine or booster, or we partner, they get a $20 gift card when they've completed a University of Maryland survey with us. So that ends our presentation. We have 4 minutes, and I don't know if there are any additional questions. We are available. We believe so strongly in partnership, and that's what System of Care is about, relationships. Systems of Care are about eliminating silos and developing integration of effort. and we would love to continue to work with you, and any way that you feel is helpful to the families that you work with. Are there any questions or comments or other needs that you see that you would like us to help you with?
I have one. First of all, Celia and Janet, thank you so much. I certainly learned a lot, especially as a faith community nurse, not only for our support organization, Holy Cross, but also practicing in my own faith community. The fact that this is something else that I can make a referral to is very, very important. So having the understanding of what you do if I come across a situation that this would be a good fit for, or maybe some sort of a starting point that I can make that connection, because that's a big part of what faith community nurses do. A lot is assessing the situation and then bringing in the resources that they're going to need. So that's very helpful, and we'll make sure that referral form is available to all of our partners.
And I will also send you the referral form for the Collaboration Council.
Great. Now, you talked a lot about barriers and complex situations that we're coming into in our very, very diverse and complicated community that we live in. But can you identify what would be one factor that you would want your family to be able, what one factor would make your family stable? Is there any one factor that you would want to promote the most to create that stability in the family? Like it is.
Well, I think it's an integrated approach. I think that you have to do with different life domains, and you have to coordinate that in a smart way. Of course, I don't have, the housing issue or the other things are difficult, but it's that the family and that young person need things across life domains. And so you can't only focus on one thing. You have to develop a plan that is integrated and puts the family in the driver's seat and the young person in the driver's seat. If you have a young person who is, I said, that family driven, that youth driven approach, along with cultural and linguistic competency. And what we are now learning is cultural humility. My staff had training on evolving the idea of cultural and linguistic competency to cultural humility, which is a different cultural responsiveness. Because you're never going to reach the stage of cultural competency, right? You're never going to know everything. And how to work with a family from their perspective, understand and respect the values and system, but at the same time, educate them and link them, help them know how to navigate all these complex systems and feel like they have a solid toolbox. Because when the providers go away, are they going to be able to sustain things? Providers come in and out of people's lives. Mental health providers, psychiatrists, they go from one teacher to the next teacher. If they're in juvenile justice, hopefully getting out of juvenile justice, child welfare. And so we have to make sure that that family can gain what they need. And again, our mantra is that skill, knowledge, and network of support and resources. If that family gets these three elements, we believe they can progress on their journey. So if they come in, like Janet has shown, they came in with one thing, what was the IEP, and Janet found all these other things. So we can't ignore that. We have to make sure that we're addressing that and helping the family become the leader in their own family construct. Because if families don't feel empowered, if we just give them things like, Gil and a family wants, Janet helps lead families to therapy. But she teaches them how to do it. How do you look at who's in your network? How do you present to your insurance company if you want dialectical behavioral therapy and your insurance company says there's nobody in network? Then we know there's parity. We have connections with those who are working with parity laws. Because the Mental Health Association Maryland did a study of access to psychiatric care through the exchanges, these health exchanges that have private insurance. And there were very few people who had health insurance, this private health insurance from the Maryland Exchange that could access psychiatric care. So we have to brainstorm then, and what do we need to help so that young person doesn't decompose, right? And what is it that we can do? And these are very complex needs, but the lived experience of saying, I'm a parent, I lived through it, I understand, building the trust and rapport and saying, I understand you're angry, I understand you're frustrated and you're scared, and I was too. But let's work together. We had family workers who got parents out of bed. They were so depressed. And we help parents link to treatment because they're dealing with such complex needs. And
Right.
Get out of bed. You're going to get out of bed now, and because we can say things to parents that other professionals cannot say.
And Celia, I have a question for you. First off, I think we can talk for hours because there's just so much information that we're interested in learning. But if I had a parent that's just learning, navigating the system, MCPS, and now struggling with the screen time,
Mhm.
with this Chromebook that they take at home and all that. Like, do you guys do support groups just for parents and
Yes,
something? Okay.
we have 3 support groups. We'll send you information. We offer
Okay.
them at different times. Janet, you want to say something about our support groups? You have to unmute.
We have, as Celia said, we have 3 support groups, and one is called Tea Time with Parents. It's later in the day. The other one is Lunch and Discuss, and the other one is Parent Connections. And what has happened, I have found when I lead one of the support groups, is parents come in with all these kind of issues. And again, we find out what they need, and we can help them navigate the system and get connected to resources. There's a lot of networking that goes along, a lot of parents sharing their different problems with each other and coming up with solutions.
And we do have bilingual staff. We have Spanish-speaking staff, which is a key point. Now, if we need other interpreting services, we are able to access the volunteer center. And Janet I think, Janet, were you the one that had a family who spoke a very rare Filipino language?
Yes.
Do you want to say a few words about that?
I don't remember the particular language, but we got a translator and we were able to get them where they needed to go. One final comment I wanted to make, because I know we have to stop and we have our prayer coming up, but it's so important to educate you all and educate as many people as we can in this society to build the infrastructure, the mental health infrastructure. And because, as I said before, we don't have enough professionals. We need to get to teachers, nurses, just as many people as we can. And with Jamie Raskin's son dying, it brought it to the forefront of Congress. Mental health, again, keep beating it on them. Mental health, mental health, mental health. So the infrastructure is really important. And I think it's great that you all wanted to hear about us. And we encourage you to make referrals. I have had several referrals from nurses to work with families where the kids are coming home from the ER or coming home from the psychiatric ward. So thank you for listening.
And we want to thank you for inviting us. And if you ever need anything and you want us to come back about, talk about anything, we're here to partner with you. It's an honor and a privilege to be here with you. And we look forward to continuing to partner to make sure the needs of families are met in Montgomery County.
Well, thank you so much, because it certainly takes everybody participating in this very big tent that we have here. So I appreciate it. We did learn a lot, and we will continue to develop this partnership, because sometimes we're faced with the situation, just the family telling us their story is overwhelming in and of itself. So knowing there's somebody else out there that can help put it in perspective is very, very helpful. So on that note, I want to thank you, and I want to thank our participants here. I will make available to the persons on this call and to our network your referral form with some information, so that they would have that at the ready as well. So with that, in the interest of time, thank you for joining us. And Lucia, would you be able to close our meeting with our closing prayer?
Yes, and right before the closing prayer, I just wanted to share briefly that there will be an event on Thursday,
Oh,
May
yes.
19th. It's called Break the Taboo. Then we'll also be sharing that as well in the email follow-up. Um, and this is also geared for parents, providers in the community, as well as teens. And if anybody needs interpreters or any access needs, they can contact the county as well.
Yeah,
But
if they needed, yeah, the Breaking Taboo is a partnership, the Mental Health Advisory Committee, which I'm on, and Alcohol and Drug. We will have a SAMHSA speaker, Dr. Baldwin from SAMHSA, who does trauma, and her colleague who does policy on a substance use level. We'll have a provider. We're going to have a youth work group. So please encourage youth to come. They will get student learning hours for if they want to participate. They will get student learning hours. They will have their own workshop with the youth ambassadors that are doing the suicide prevention and substance use, Be the One, with the county and trying to help kids in schools. So they'll have their own workshop, and then we're going to come back and have a youth panel. And the youth themselves are going to share what they need, what worked, what didn't work, and what they hope will happen in the county. So I hope you can do the taboo, breaking the taboo. It's going to be an excellent spring forum. It's virtual, so please register. And I said the interpretation needs by May 2nd. If you can encourage people to let Diane Linegar know by May 2nd if they need interpretation. They will provide it in all different languages, but they need to know in advance.
Thank you, Celia. I'm so glad that you're so involved in the community, and we really appreciate partnering with you. So, and thanking our presenters, Janet and Celia, and having heard these presentations, I just wanted to invite you all to for this closing prayer. So, Lord, grant us clarity and insight to better carry out your will in our work. Lord, I pray for a successful implementation of the resources we have learned about, and bless the mission of the Federation of Families to bring hope and healing to the persons they serve. Christ, hear my prayer. Amen.
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 Thank you so much.
Thank you so much, and we will continue to stay in touch. Thank you for the work that you do.
Bye-bye.
Thank you. Bye. Have a good afternoon. I'm going to stop the recording. Hang on.